As we finish our discussion of the immune system, there's some tables here that just have some quick overview information for you to remind you what different parts of the immune system do. So your antigen-presenting cells, remember, are going to be responsible for processing those antigens and packaging them up and putting them out on the cell surface so that the T cells can recognize those and mount an immune response. Your cytotoxic T cells are going to be responsible for releasing chemicals that directly cause the death of a pathogen or cause the destruction of antigens. Your helper T cells are going to secrete chemicals that stimulate the proliferation of T cells and B cells, and may also secrete some chemical factors that help to stimulate the immune response. Your lymphocytes include your memory cells, your memory T cells that are going to be specialized cells that can proliferate and go into action. So if they're cytotoxic T cells, they can be activated and proliferate and clone and make active cells that will directly destroy those cells. So they take on the action on the next response to that particular antigen. So your memory cells are there for that quick response on the next time that antigen is presented. Your B cells are going to differentiate into plasma cells, and your plasma cells then are going to secrete antibodies, and your memory B cells do the same thing as your memory T cells. So they are some of the clones of those cells that were activated that are ready to go into action on the second or subsequent responses to the same antigen. Now we want to look just a little bit at some disorders associated with the immune system. And the first one we want to talk about is acquired immunodeficiency syndrome, which is a condition where a person experiences an assortment of infections due to the progressive destruction of the immune system cells by human immunodeficiency virus. So HIV is the virus that causes AIDS, the symptom or the syndrome. So AIDS represents the end-stage infection by HIV. Typically, a person who's infected with HIV may be symptom-free for many years, but even so, the virus is actively attacking the immune system and replicating within immune system cells. In the 2 decades since the first 5 cases were reported in 1991, over 22 million people have died of AIDS. Worldwide, it's thought that there are somewhere between 35 and 45 million people infected with HIV. So HIV is present in the blood and body fluids, and it's transmitted or spread from one person to another by actions that involve the exchange of blood or body fluids between people. So HIV is transmitted in semen or vaginal fluid during unprotected sex. Can also be transmitted during anal, vaginal, or oral sex. HIV is transmitted by direct blood-to-blood contact, such as when you have IV drug users that share needles, or sometimes healthcare professionals who may be accidentally stuck by HIV-contaminated hypodermic needles during their practice. In addition, HIV can be transmitted from an HIV-infected mother to her baby at birth or during breastfeeding. However, HIV is a very fragile virus, so it can't survive for long outside the human body. It's not transmitted by insect bites. You can't get infected by hugging or casual contact or sharing household items with someone that is infected. So HIV primarily damages the helper T cells, replicates billions and billions of copies each day. The viruses replicate so rapidly that the infected plasma cells end up undergoing cell lysis, or the cell membranes, the plasma membranes of the infected cells undergo cell lysis. In addition, the body defenses attack the infected cells. Helper T cells usually are replaced as fast as they're destroyed, but after several years, the body's ability to replace those damaged T cells becomes exhausted, and the number of T cells rapidly declines. So after about 2 to 10 years, HIV destroys enough T cells that most infected people begin to experience some of the symptoms of immunodeficiency. And as the immune system slowly gets destroyed, the HIV-infected person becomes susceptible to secondary or opportunistic infections. AIDS is usually diagnosed when the helper T cell count drops below about 200 cells per microliter, or when those secondary or opportunistic infections arise. Let's see, treatment. At present, of course, infection with HIV can't be cured. There are vaccines that can block new HIV infections and also help to reduce the viral load in those that are already infected. Some of the drugs that can be used are AZT, which can inhibit the enzymes that are necessary for replication of the viral DNA, and that can limit the spread of the disease. Let's see, combination drugs. Typically, it has been found that a drug cocktail of several antiviral medications is most effective in helping to keep the progression at bay. Usually it is, though, from overwhelming secondary infections or cancers that develop because of the HIV infection that end up causing the death of the infected person. Organ transplant involves the replacement of an injured or diseased organ, such as the heart or the liver, kidneys, lung, pancreas, with a healthy organ from a donor, from another individual. Sometimes this may be from someone that has been killed in an accident, or someone that, for instance, kidneys. We've got 2 kidneys. Sometimes a person will donate 1 kidney, so a healthy person donates to someone that is suffering from kidney disease. Usually the immune system recognizes those proteins, though, the antigens on that transplanted organ as foreign, and then will mount a cell-mediated and antibody-mediated immune response against them, and this can cause a condition known as graft rejection, where that tissue is then destroyed by the immune system. So in order for a transplant to be successful, you need to match as many of the major histocompatibility proteins between the donor and the recipient of the organ as possible. The more of those HMC or MHCs that match, of course, the less likely the host is to reject that organ. When you receive an autograft, that is when tissue is removed from one place in a person to another place. For instance, my grandmother, before she passed away, fell and had to have skin. She had a really bad abrasion and gash, a cut area on her shin, and so they had to remove some of the skin from her hip to put over that place, or the damaged area, so that it would start to heal. So that was an autograft, tissue from one person in one place to another place on the same person. An isograft, iso means same, so an isograft can only be done between genetically identical twins. Because of that, or the reason behind that is, of course, that because you do have the same DNA with an identical twin, that your major histocompatibility complexes should be the same as well, so much less likely for rejection to occur. An allograft, allo means same, is tissue taken from a non-related person. So, for instance, if you donated a kidney to someone, that would be an allograft, because most of the genes in humans are common within the same species. You're decreasing the likelihood of rejection, but certainly not completely getting rid of that chance of rejection. A xenograft is when tissue is taken from another species, such as pig valves being put into a human heart. That is one of the more successful types of xenografts. Of course, again, the more genes you have in common with someone, the more proteins you will make in common, so the more of those antigens will be in common. However, only in the case of an iso or autograft will you have very, very small chance, or will you have a smaller chance of rejection. So you've got to do something such as taking immunosuppressive therapy drugs that will knock down the immune response and prohibit those immune system cells from mounting a response against those tissues and causing them to be destroyed. However, when you are basically destroying your immune system, you're also leaving that person in great risk of developing those secondary infections. Autoimmune disorders is when the immune system fails to recognize your own antigens and attacks your own tissues. Autoimmune diseases usually arise very early in adulthood and are fairly common. An estimated 5% of adults in North America and Europe are afflicted by autoimmune disorders. Females are more susceptible to autoimmune disorders than males. Actually, they're twice as likely to suffer from those autoimmune disorders. Under the influence of unknown environmental triggers and certain genetic factors can make some people more susceptible. So self-tolerance breaks down, leading to the activation of self-reactive clones of those T cells and B cells. These cells then generate cell-mediated or antibody-mediated immune response against your own antigens. So some examples of these we'll look at include a variety of mechanisms. Some of these involve the production of autoantibodies, or antibodies that bind to and stimulate or block your own antigens. So autoantibodies that mimic thyroid-stimulating hormone are created during Graves' disease, and this leads to hypersecretion of thyroid hormones. Autoantibodies bind to and block acetylcholine receptors that cause muscle weakness, and that is one of the characteristics of myasthenia gravis. Other autoimmune diseases include activation of cytotoxic T cells that destroy certain body cells, such as you find in type 1 diabetes mellitus, where the T cells attack the pancreatic beta cells that produce insulin. In multiple sclerosis, the T cells attack the myelin sheaths and destroy those myelin sheaths around the axons of neurons. Inappropriate activation of helper T cells can also occur in certain autoimmune disorders. Rheumatoid arthritis, systemic lupus erythematosus, boy, that's a word that never wants to come out easily. Rheumatic fever, hemolytic and pernicious anemias, Addison's disease, Hashimoto's disease, and ulcerative colitis can be caused by those T cells being inactivated or being inappropriately inactivated and leading to the immune response. Some of the therapies for some of the autoimmune disorders include removal of the gland, if it is the thymus, or injections of interferons, immunosuppressive drugs, or plasmapheresis, where the person's blood plasma is filtered to remove the antibodies and those antibody-antigen complexes and then put back into the body. This does help to decrease some of the effects of these autoimmune disorders. A person who is overly reactive to something that's usually tolerated by other people is said to be allergic or hypersensitive to whatever that is. However, when the allergic reaction takes place, some tissue injury does occur. The antigens that produce allergic reactions are called allergens, not antigens. Some of the common allergens include certain foods such as peanuts, milk, shellfish, eggs, antibiotics such as penicillin and tetracycline, vaccinations such as the pertussis and typhoid vaccinations, certain venoms as found in wasp and honeybee stings or snake bites, cosmetics, chemicals in plants like poison ivy and pollens, dust, mold, certain dyes that contain iodine that are used during x-ray procedures, and even some microbes can cause allergic reactions. So we look at different types of allergic reactions and we classify them based on how the body is reacting and what is happening. So allergic reactions can be localized, such as what happens during a bite or a sting from a bug, or they can be systemic, where that allergen is traveling through the blood and causing reactions to occur throughout the body. Your sensitivities can begin very, very quickly, especially with your immediate hypersensitivities. May not have any encounters on the first time that you are exposed to this particular allergen, but in the subsequent responses, the B cells have already produced vast amounts of antibodies, so you have a widespread response very quickly. That second exposure is also going to cause basophils to release histamine, Remember, histamine is a very powerful vasodilator, so it's going to cause runny nose and redness in tissues and itching and watery eyes. A lot of the allergens that cause these immediate hypersensitivities are inhaled. We breathe something in, such as dust or pollen or molds, or something that is ingested. We take it in as we're eating, or we swallow something that can cause those immediate reactions. A lot of these immediate hypersensitivities can be treated with over-the-counter antihistamines that block those basophils from releasing histamine. However, there are times that these allergens can cause an anaphylactic response. Your anaphylactic response, of course, is going to be triggered by that histamine and also prostaglandins and leukotrienes. So these widespread vasodilators cause an increase in capillary permeability, increase the smooth muscle contraction of the airways of the lungs, increased mucus secretion. So because of all this, a person can experience inflammatory responses that lead to difficulty in breathing through those constricted airways and excess mucus secretion. In anaphylactic shock, so these reactions are known as anaphylaxis. So in anaphylactic shock, a susceptible individual who has just received something that triggers this, or they've been stung by a wasp, may experience wheezing and shortness of breath as the airways constrict. And it's usually accompanied by shock due to that widespread vasodilation and loss of fluid from the blood, which can lead to a rapid and profound decrease in blood pressure. So this can be a life-threatening emergency, but also can be treated very quickly and easily with an injection of epinephrine that can help to dilate the airways and also strengthen the heartbeat. Cytotoxic, or what we sometimes call subacute hypersensitivities, are caused by antibodies directed against antigens on a person's blood cells, such as would happen during an incompatible drug transfusion that would lead to lysis of the cells. This usually has a slower onset, of course, than the immediate hypersensitivities and may begin 1 to 3 hours after exposure, and also may last much longer as well. Delayed hypersensitivities usually appear somewhere between 12 to 72 hours after exposure to an allergen. So these reactions occur when allergens are taken up by antigen-presenting cells that migrate to the lymph nodes and present the allergen to the T cells. The T cells then proliferate and mount an inflammatory or an immune response that can lead to inflammation. Certain bacteria, such as the bacteria that causes tuberculosis, can trigger this type of cell-mediated response, but also certain haptens, such as are found in the toxin in poison ivy, can lead to these delayed hypersensitivities. As we age, most people become more susceptible to all types of infections and malignancies. The response to vaccinations is decreased, and they tend to produce more autoantibodies, or those antibodies that attack your own antigens. The immune system exhibits lower level of function overall. T cells become less responsive to antigens, so fewer T cells respond to infections. This can result from age-related atrophy of the thymus or decreased production of the thymic hormones. Remember, it's the thymus where our T cells are programmed and learn to respond to foreign antigens. Because the T cell population can decrease with age, B cells are also less responsive, because remember, the T cells have to activate the B cells. So if the B cells are less responsive, then antibody levels don't increase as rapidly in response to foreign antigens. So this results in increased susceptibility to a number of different infections. So it's for this reason that elderly people are encouraged to get a flu shot each year, because we don't retain those memory cells as long, because the B cell production and the T cell production has decreased. I wanted to include this slide not for testing purposes, but just to give you an overview of how interrelated body systems are. The immune system and the lymphatic system work with most all body systems. So the lymphatic system drains tissues from the interstitial fluids of the integumentary system, and the skin houses certain immune cells. The skeletal system Lymphatic vessels drain interstitial fluid and leaked plasma from proteins that surround the connective tissue around bones and muscles. The endocrine system can influence the flow of lymph and cytokines by releasing hormones. The lymphatic vessels drain interstitial fluid around the glands. Lymph returns fluid that's been filtered and cleaned up back into the cardiovascular system. And of course, the immune system cells travel in the cardiovascular system. The respiratory system has tonsils and patches of lymphatic tissue that help to protect the body from pathogens getting in. And again, lymphatic tissues drain the interstitial fluid. The digestive system has tonsils and the mucosal associated lymphatic tissues that help to defend against pathogens getting in and penetrating the body. The digestive system also has the saliva and the gastric juices that destroy pathogens when they get in. Lymphatic vessels pick up the excess fluid around the tissues and return it back to the cardiovascular system. Lymphatic vessels drain excess fluid around the kidneys, and the mucosal associated tissues help to defend the body against toxins and pathogens that penetrate through the urethra. So the urinary system, of course, is tied in with the lymphatic and immune system. And the reproductive system, the pH in the vagina is inhospitable to foreign bacteria. The malt tissues help defend against toxins that could penetrate the body through the vagina and the penis because they both have openings to the external environment. The lymphatic tissue provides antibodies in the milk of nursing mothers and helps to protect the young. So all body systems are tied together. You could do this with every system that we look at and find some way that all body systems are tied together. So as you're learning about the human body, I hope you've realized that all of these systems are interrelated and tied together and dependent on each other for homeostasis of the human. All right, let's end the immune system with a couple of questions for you. So breast milk provides an infant with antibodies helping to protect the infant. What type of immunity is this? Well, the first thing you've got to do is decide if it's natural or artificial. Remember, natural is when you get something in a natural way. You get a disease, or, as we talked about with breast milk, we had natural immunity coming from mom to the baby. Artificial was that you are artificially exposed to something, right? So active immunity was when the immune system creates those memory cells and those antibodies. Passive immunity was when you receive those antibodies and your immune system doesn't make it. So natural, from baby to mom. Active, well, if the antibodies are coming from the breast milk, then the baby's immune system is not making it. Passive, received immunity. So the answer is naturally occurring passive immunity. The next and last question, which of the following cells requires antigen presentation to be activated? All right, so T cells. Well, we know that the T cells are activated when they see an APC, right, an antigen presenting cell. What about the B cells? Well, the B cells are activated by the T cells. Macrophages are just big eaters, right? So they're just chomping around. They don't require anything being presented to them, right? So all of the above is obviously not the answer. T cells was the correct answer.